Hello, everybody, and welcome. This is a continued conversation session with an amazing panel of experts on supporting working families. And my name is Aysha Pamukcu. I'm a senior staff attorney at ChangeLab Solutions. So for those of you who are just joining us, this panel is part of a bigger series called Building Healthy, Equitable Communities. This is a new project from us at ChangeLab Solutions, and it's a virtual space to explore the elements of a just community and making sure that we have the conditions that will help all children and families thrive. So over the next 6 months, we're going to be releasing 6 collaborative episodes that give training and discussion on how policy and community power can advance health equity. So you can see the full schedule on the last slide, and you can also check out our series homepage. We just wrapped up episode 1, which was about health equity as a principle and as a practice. And it kind of gave us a high-level framework to explore some of these deeper content areas in future episodes. So in episodes including this one, we're going to be discussing how to apply this health equity framework in specific places. Now, on this slide, you can see what each episode will contain, and that will be 3 components. The first is a blog post about the consequences of laws and policies that don't take health equity into account, and it gives some suggestions for how we can respond. In this, which is episode 2, we looked at 6 federal policies that say that they're going to support the health and well-being of working families, but unfortunately sometimes they fall short. We'll also host a webinar that provides on-the-ground stories and innovations from community health leaders and also points you all to resources to support your work in healthy change-making. So last week we had a webinar that explored paid family leave policies to support and strengthen low-income families and help drive health equity. Last, we'll be closing each episode by moderating an expert panel, and we will be joined by equity innovators who will be in conversation with each other as well as responding to questions from you. So that's what we're here for today, and we have some really amazing and diverse expertise in family supports, including breastfeeding, paid family leave, sick time, and early child care and education. So let's quickly touch on format. I have a set of questions that I'm going to pose to our panel, and this has been generated by series participants. So we've actually sourced all of our questions from you all through the blog, the webinar, and the registration page from today's panel. What we've done is we've taken these questions, put them together, and will now pose them to the folks joining us today. And that being said, if you do have questions that arise during the panel, please do enter them in the chat box on your screen, and we will do our best to answer your questions. So with that, I'm going to turn it over to our speakers to introduce themselves and their organizations, and then we'll move from there into conversation. So to do introductions, let's start with Kimarie, then Sharon, then Sherry, then Yvette. So Kimarie, I'm going to start by passing the mic to you.
Hello, everyone. My name is Kimarie Bugg, and I am a nurse practitioner, and I have a master's degree in public health. I am in the state of Georgia in Atlanta. I am the CEO and president of Reaching Our Sisters Everywhere, which we affectionately call ROSE. And our mission is to address specifically breastfeeding inequities in communities of color. And I'm really excited about being here and working with these questions.
Thank you so much. Sharon?
Hi, everyone. This is Sharon Herman. I direct the Work and Family Program at Legal Aid at Work. We're a nonprofit legal organization based in California that promotes the employment rights of low-income workers and their families, and we do that through direct legal services and representation, education and outreach, and policy advocacy. We were part of the coalition that helped to pass the nation's first paid family leave law back in 2002. And then since 2004, when the law was implemented, we have been working with our coalition partners to make the law more equitable and accessible to those who need it most. So I'm really excited to be a part of this conversation today, and look forward to talking more.
Thank you, Sharon. Sherry?
Yeah, hi. I'm also delighted to be on this panel. My name is Sherry Leiwant, and I am co-president and co-founder of A Better Balance, which is a national legal advocacy organization that's based in New York City. And our mission is to ensure that workers can care for their families without risking their economic security. So we have drafted most of the paid sick time laws that have been enacted around the country, as well as many of the paid family leave proposals. And we had a tremendous victory here in New York in 2016. We passed a strong paid family leave law that just went into effect in January. And we are helping to implement that law through a hotline and lots of trainings and outreach. And I just want to mention that we also have helped pass pregnancy accommodation laws around the country, and laws that ensure more certainty for scheduling for low-wage workers. So we are very focused on the health implications of the issues that we're working on, and so I look forward to this conversation.
Wonderful. Thank you. And then Yvette.
Hi, good afternoon, everyone. I'm Yvette Sanchez Fuentes. I serve as the Deputy Chief for Policy and Research at Childcare of America. We are a nonprofit organization based in the Washington, D.C. area, and our mission is focused around ensuring accessible quality care so that families and communities can really be supported in their economic and educational goals. We, in addition to that, work closely with child care resource and referral agencies across the country, and we provide direct services and training and technical assistance as it relates not only to child care, but health, emergency preparedness and disasters, and advocacy and federal policy. I'm looking forward to the conversation today, so thank you.
Thank you, everybody. And to our audience, now that you have a sense of who's joining us on this panel, and you can kind of see the faces that go to the voices and really the wealth of expertise that we have joining us today, do feel free as questions come up to insert them in the chat box, and we will do our best to get to them. So with that said, let's go ahead and kick things off in our discussion of different supports for working families. One thing that I think is a really great place to start is if folks can briefly share what health equity means to their organization. In this series, we've been exploring this question through the lens of different fields and disciplines, and I think it's really helpful to get a sense of where everyone's coming from when we talk about the question of health equity. Maybe to get us started, let's start with Kimarie, then Sharon.
Okay, thank you. So I'd like to start with a story. I'm a storyteller. And recently I attended a conference in Ohio, and there were 300 people at the conference. And there were 298 women and 2 men who attended this conference. So in this hotel, there were 2 large restrooms on the floor where the conference was held. So what the hotel chose to do was to put fresh cut flowers in the urinals in the men's restroom and convert that restroom to a women's restroom. And this, one of the first things I needed to do, because I do a lot of presentations, is I had to get my phone and take pictures, because to me and the organization that I serve, that's what equity is. Equity is assuring that the population that you serve are getting what they need, not what it is I want to give them, not what it is I was specifically trained to do, but that they are being presented with what it is that they need to move along the health continuum to achieve the goals that they choose. And that's what this group did for that 298 women, so that we could be comfortable in the setting. So that's what health equity is for the organization that I work with and the communities that I serve, providing them with the resources, the education, the support that they need.
Yeah, so I mean, for us, I think health equity means ensuring that all families, especially those who are most vulnerable, have meaningful access to policies and programs like paid family leave that improve the health and well-being of their families. So we know that paid family leave is just that kind of policy that, the evidence has shown us that it does, lower rates of maternal depression and improves the health of infants and children and increases duration and rates of breastfeeding. So it's really concerning to us when we learn that this policy is not being equitably accessed by all communities. In California, for example, where we've had paid family leave on the books for well over a decade, we've learned that low-income people and people of color are least likely to know about and have meaningful access to the program. A 2015 field poll here showed that only 36% of California voters had ever heard of the program, and low-wage workers, Latinos, and new immigrants were least likely to be aware of it. And that's really alarming because this is a program that's funded entirely by workers through deductions from their own paychecks. So they're paying for a program that they don't know exists and therefore aren't using. So we have been engaged in different forms of advocacy to try to dismantle those barriers and ensure that people can access these policies that promote health for the whole family.
Wonderful, thank you. And before I go on to the next question, chime in for our other panelists, chime in if you want to tackle that question, but I'll just continue down the list and call out folks as we go otherwise.
Yeah, this is Yvette with Childcare Aware of America. So I would just ditto everything that is previously said and really just build on that in terms of when we think about childcare and really the impact that childcare plays, not just on children's health, but contributing to the long-term positive development for both the child and the family. And then when we're really thinking about meaningful access, we talk a lot about what families need, but also thinking about what providers, teachers, and staff need in terms of the professional development and obviously wages, because we really want to make sure that families have choices. So not just center-based choices, but thinking about family childcare and even thinking about non-traditional hours as we're thinking about all of the choices and everything that families need in order to be successful.
Yeah, thank you. And this is Sherry. I want to also just echo what everybody else said in terms of particularly paid family leave, which we have this tremendous challenge of. The initial challenge is that there aren't enough programs in the country, but for the states that have enacted this really important benefit, it has been really shown time and time again that those who need it most, low-wage workers and their families, aren't aware of it. And so just trying to think about who can do this meaningful outreach, who the best messengers are, how to get the word out to really as everyone's saying, meet people where they are in terms of the information that they really need to access the benefits that are going to help their families is a really big challenge, and I think one that we really can enlist the support of healthcare providers in particular to help us do that.
I think that's exactly right. This is Sharon again, and I think that A Better Balance has done great work in this area, and Legal Aid at Work is also trying to really kind of harness those partnerships with health and social service providers so that those are folks that low-income families are already seeing for critical services and care. So we've been really excited about creating innovative partnerships with health providers to actually provide Know Your Rights materials on site, at prenatal clinics and WIC clinics, providing counseling and technical assistance to folks, and training providers so that they can recognize the employment needs of their patients and clients and then refer them on to us for help. So I think that's sort of an interesting model that we've been experimenting with, and I know Better Balance has too, that I think has some promise for trying to tackle the awareness gap.
Thanks so much for that, you all. And kind of in the spirit of thinking further about what it means to have meaningful access, to make sure that all folks in the space get what they need and families have choices, I'd love to hear about, in the context of your specific work, if you could highlight a particular support or strategy for working families that you think really stands to achieve a high level of impact. And maybe let's just start off this question with Sharon and then Sherry.
Sure, yeah. I guess kind of in terms of the strategy, sort of picking up on what I was just speaking about, just to kind of share one concrete example of a client that was recently referred to us by her OBGYN at this local prenatal clinic, and she was pregnant with twins and fired from her job for taking too much time off for prenatal care for her high-risk pregnancy. So her OBGYN, whom we had trained, referred her to us, and we were able to represent her and negotiate to get her back to work with compensation for her lost wages. So that's just sort of kind of shines a light on one way that these kinds of partnerships can, I think, make a huge difference for individual families. And also just on this policy question, what are the supports that make the biggest difference? I think for us, it's hard to pick just one because people need support at all times in their lives, but I think focusing on the particularly vulnerable moment of pregnancy and welcoming a new child, we've seen that can be really, really critical to ensuring that families, can retain their economic security and promote their health and protect the health of their pregnancies without jeopardizing their jobs. And so I think the policy that comes to mind for me that would achieve the greatest impact is job-protected paid family leave. And as the blog post describes, this is the FMLA, the federal law, provides job-protected time off, but it's unpaid, and it only covers 60% of the workforce because it has really strict eligibility requirements, including a requirement that only people who work for large employers can get this leave and know that their jobs will be waiting for them. So that's something that I think a lot of people don't realize. Like in California, we have paid family leave, but many people don't know that you could actually be fired for taking paid family leave unless you have independent coverage under a job protection law like the FMLA. So I think it's really important to try to make sure that the laws are updated to ensure that all families can be there with their children and to care for a loved one who's ill, without risking their jobs and income.
Thank you. And Sherry, do you want to chime in?
Yeah, I do, and I that's great, Sharon. I mean, I totally agree with everything that you said, and we did work really hard to ensure that when we passed paid family leave in New York State, that job protection was included. And one reason that we were able first of all, able to do it, but one reason that we really made it a kind of a centerpiece was some of the research that was done in California showing that some low-wage workers were not accessing the benefit because they were afraid of losing their jobs, but also the organizing that we did in some of the low-income communities in New York, where when you're asking about like what would make sense for this program, what's important to you, that was number one. And so I think it's it's just really important when crafting kind of new policies that that people who are going to be impacted be part of the conversation about what you're going to because there are always going to be compromises, and there's always going to be some difficulty in passing progressive policies, but it's important to keep in mind what's going to be most effective and what's going to make the most difference for the families that need those policies the most. And in addition, just to echo what Sharon said about the importance of paid family leave, because I would also choose that as a major support for working families that we really need to do something about here in this country. Most people don't realize the United States is one of only 2 countries in the entire world that does not require paid maternity leave, and the results of that in terms of maternal stress, in terms of stress, in terms of family stress, in terms of health of infants, both breastfeeding and also just finding childcare for really, really young babies. It just can't be overstated, and it's kind of a scandal that we do not have a national program to support mothers. And I think that I really do think, I don't know that the research has really been done, but the connections between the lack of paid family leave and our kind of abysmal record on infant and maternal mortality, I think are really linked. And obviously we do know certainly that it has a real effect on breastfeeding and breastfeeding initiation and sustainability, being able to actually take off the amount of time you need to be with your new child without risking your economic security is extremely important. So it's just I think the importance of this policy of having paid family leave for families and the health of families just can't be overstated.
Thanks so much. Any other thoughts on this question before we move along?
Yeah, this is Kimarie. And so I'd also like to add advocating for a living wage. I work with people who work 2 full-time jobs during the week and then another job on the weekend. And so it's very difficult to be pregnant and also definitely to raise and take care of children. And of course, a lot of those funds go towards child care, but also would like for you all to be familiar with an organization called Moms Rising, which is a community-based organization that advocates for things such as a living wage, and also has done a lot of research on the fact that many pregnant women, a large number of pregnant women, and the CDC has confirmed this, go back to work at about 2 weeks postpartum, so that they can keep their jobs. And so this is, of course, also very detrimental to the mother's health, but definitely negates breastfeeding, and of course those women tend to breastfeed a lot less time. So advocating for a living wage for families and women, and especially, as you said, all those things with pregnant women also. So thank you.
Wonderful, thank you. And let's zoom in on the question of breastfeeding. We had a number of questions come in before and during the webinar on how different sectors can support working families in their breastfeeding goals, and specifically how we can incorporate breastfeeding when we're talking about building equitable communities, particularly for Black women. And kind of a second piece to this question is, since we have folks who are representing work in so many different sectors on this panel, how can different sectors support and normalize breastfeeding? So both within the healthcare space and outside of it. Kimarie, let's start with you and then go to Sharon just to start us off.
Okay, thank you. So from the beginning, some of the things that we need to do is to be sure that breastfeeding is being sort of talked about specifically by healthcare providers with pregnant women. What the research shows is that physicians don't talk to, you mentioned African American women, about breastfeeding because they say that the literature, the research says that Black women don't breastfeed. That is just totally untrue. CDC statistics show that approximately 70% of African American women initiate breastfeeding. So they initiate breastfeeding, but then there are major challenges, and those challenges even start prenatally, as I mentioned, with healthcare providers not giving women the resources, the information, the tools, so that they can make an informed choice. And that's what we need to normalize breastfeeding. We also need facilities that are baby-friendly, because then the policy dictates that all women will hopefully get the same care. We know that in hospitals that are not baby-friendly, again, the care that is given to women of color many times is different than care that are given to other women of other ethnicities. So we need to make sure that the hospitals are equitable, and working with hospitals, of course, that are on the pathway, that are working towards baby-friendly, truly does make a difference. Also, then, when moms are discharged from the hospital in those 2 to 3 days that they are there, it is very important that they get out of the hospital successfully breastfeeding. A few years ago, that didn't happen 50% of the time with women who were delivering in the hospitals. They did not get out successfully exclusively breastfeeding because of all this stuff that happens there, but many, many more are now. Then we have to make sure that there are lactation supporters in the community that have the evidence, have the training, have the knowledge to help them to be successful. Academy of Pediatrics recommends breastfeeding exclusively for 6 months and then up to a year and beyond, and the World Health Organization 2 years and beyond. So since they're only in the hospital for 2 days, we've got to build the community to help with those other, 363 and beyond days. So that includes lactation supporters that are peers, that are CLEs and CLCs and IBCLCs, that also includes breastfeeding of medicine physicians, but that truly includes making the community breastfeeding friendly. It's difficult when women, go to restaurants and other places and are scorned for nurturing and nourishing their babies. So helping breastfeeding to become the norm, which it already is, because in this country, 84% of women initiates breastfeeding. So that means that more start breastfeeding than not. And so breastfeeding truly is the norm. So we have to acknowledge that and just sort of act like it. And I'll pass now.
Great. I love that. This is Sharon. That's all so important. And I think the other piece of the puzzle is really kind of what the employer community can do to support and normalize breastfeeding, and how we can change our public policies to make that happen. And so, of course, paid family leave is part of that because it helps new parents establish and maintain breastfeeding. But the other piece is lactation accommodations when parents return to work. And we do have federal law that requires a private space and reasonable break time to pump at work. But this is an area of law that is rather under-enforced, and I think many people don't feel comfortable asking their employers for these kinds of lactation accommodations for fear of stigma or retaliation. So in San Francisco last year, we were excited to be part of a campaign that to pass a local ordinance that we think is the most comprehensive in the country on these issues. And the law went into effect this year, and what it does is it sets minimum standards for lactation spaces at the workplace. So federal law is sort of silent on this, but this kind of gives some more clarity to what a lactation space should include. And so it has to be clean and sanitary and free of toxic materials. There has to be a place for an employee to sit, which, believe it or not, we've heard from a number of clients who've been forced to pump, standing up or in a hallway. There has to be a shelf to place the pump. There must be access to electricity to plug in the pump, and then close by there needs to be a sink and refrigeration. The other two things that this bill does, which I think are pretty interesting and novel, one is that it requires all employers to create and disseminate written lactation accommodations policy, and they need to disseminate it to all employees, whether or not they are parents or are asking for accommodations. Again, seeking to kind of normalize breastfeeding. And then the last thing it does is that it creates as a requirement for new construction or renovations of buildings to include lactation spaces in their plans, which we hope also will be another way to get various people in different sectors thinking about and contemplating breastfeeding as a normal part of daily life for many people. And so we're really excited about this bill, and as I said, it's just gone into effect in San Francisco, but it also has served as a model for state legislation that's currently being considered in California. It's SB 937. My organization is co-sponsoring it with the California Breastfeeding Coalition, and there are a number of supportive organizations, including health organizations. And so if anyone wants more information about that, feel free to get in touch offline.
Thank you. Any other thoughts on this question before we continue? Okay. So another question that arose is basically around the relationship of program and policy. Specifically, what role can a comprehensive early childhood program play in addressing health equity? So another way of thinking about that would be, what can be done within the four walls of an early childhood program, or any programmatic work to impact some of the bigger health equities that are the result of the social determinants of health? And of course, the challenge here is that these issues happen largely outside of the program. So Yvette, let's start with you.
Sure. So I just want to say really quickly that I really appreciate what my colleagues all shared about breastfeeding. I think it's a really important piece for everyone to be aware of. But I do think on this question around the four walls of an early childhood program, so we know that we have two huge early childhood programs in this country, Childcare and Head Start, but we also know that many families don't have access to quality care. I think over the last 2 decades, both of these federally funded programs have done what they can to support the professional development of the folks who care for our kids every day in these programs, to start to think about what are the tools, the resources that they can implement within the four walls that are not just helpful for children, but really helpful for the adults in the child's life every day. And so I think that we've seen that with research and with more attention really being brought to the table around how adults are feeling impacts kids, it's really we're starting to see some changes in how kids are cared for. But I think that this also goes back to a bigger piece around that we really do need policies from childcare, from paid family leave, from living wages to really think about what is it that families and communities need in order to make sure that health equity and equity in general is happening for families and communities and they're getting what they need. I will say that I think often that we say that Head Start is really sort of thinking about how to do all of these comprehensive services, but I would just push people a little to really think about how do you actually implement the services that families need. So it's really easy to make a referral if a family has an employment or health or a housing need, but what's the follow-up and what is the intentional collaboration with other community partners to make sure that families and parents are getting what they need in order to support the development of their kids, but also of really like all of the folks around them. So we've seen some really interesting initiatives around the country around how individuals are really thinking about this at the local level, so thinking about how grocery stores can be one-stop shops. Many of us have seen community centers or community health centers that have become one-stop shops, or really just thinking about early childhood centers partnering with other local organizations to make it easy for families to have meaningful access to the things that they need.
Thank you so much. I think we'll go from there, unless there are other folks who want to weigh in on this question.
I just wanted to mention that also there are the school-based health clinics also do a lot of work with starting with early childhood initiatives to do just as she was saying, and to make sure that the programs are comprehensive and making sure that they're for the children, that there are exposures to things that they may not be able to be exposed to in their communities, such as horseback riding and rock climbing and, kayaking, and introducing the families and to the internet and to different types of technology, and having community centers in the child care centers that also include introducing families also to environments that may not be available in the communities where they are. But school-based clinics also work a lot in that arena.
Wonderful. Thank you for those thoughtful responses. Another question that we've been receiving is kind of around how a lot of these really great policies and practices get funded. So in the context of your work specifically, how might we fund some of these policies and initiatives that support working families? And if any come to mind, are there examples of a community that's really doing a good job connecting this work and funding? Sherry, let's start with you and then go to Yvette.
Well, I think we all rely very heavily on foundation funding. So I think that's definitely a space where there is some recognition that the policies we're talking about are really important in terms of equity and in terms of some of the really serious both health and other kinds of issues in terms of equality in our society. So I think there are a number of foundations that are funding certainly the campaigns to change the laws. I think what ends up happening, though, is that there is a sense that the enforcement of those laws, once they're passed, are not as exciting and a little harder to really fund. And so I think that becomes a question of really advocating with the states and localities to invest in outreach and education and legal services supports to help people really, access the rights that they have once these laws are passed. And we've been doing a lot of work around those issues, because there's no point in passing laws, as good as they might be, if people don't know about them and they're not being used. So I do think that using the health lens is something that can both generate funding from a lot of foundations, and particularly community foundations that are very interested in health, but also can push some of government agencies to pay more attention to outreach and education. So that's what we've been working very hard to try to do that. Because you're right, we need funding. And with respect to some of the leave laws that I'm talking about, or the discrimination laws, which is where the space where we work, there's not an initial funding. There isn't an initial funding need the way there is for childcare, where you really do need, you need a lot of, you need that financial support to even be able to have good childcare and to have it available for the community. So, I think enforcement of the laws is really something that is kind of inexpensive, relatively speaking, to a lot of other things that you can do to improve the lives of working people and the health of people with families. So, I think that is advocacy that is well worth engaging in.
Wonderful. Thank you. Yvette, what about you?
Yeah, I would just say that on the child care side, early childhood side, obviously the majority of money really comes from the federal government, but I would just remind folks that families also pay a huge amount. I think probably many folks are aware of a lot of the research around how quality child care now costs more than college tuition in some states and in some communities. And so I think a couple of things to keep in mind is that when we are sort of putting forward these new policies or laws, really thinking about what does the implementation look like at the local level. I think sometimes these laws and policies at a national level or at a higher level seem like a good idea, but until people try to implement them, you truly find out what the obstacles are. I agree that accountability is a huge barrier, and I think it often gets in the way of local communities really trying to innovate around how they do that. And then, I would just add, I think during the Obama administration, we really tried to think about this funding lever and how you could really push communities to do that. And so the prime example around that is the Early Head Start Child Care Partnerships, where it was an initiative and an intent to really try to raise the level of quality in child care programs, while at the same time trying to make sure that more kids and more families were having access to a quality system. We're still waiting to see how all of that has turned out, but anecdotally we know that at the local level, for those who really understood the fiscal constraints and how to cost allocate, people were able to figure out how to blend some of this money in order to really think about raising quality and raising wages and increasing professional development to give families more choices. And on the other side of that coin, we've also heard that folks are really nervous about being held accountable through monitoring and enforcement. So it'll be interesting to see what the data on that ends up looking like when the Department of Health and Human Services releases that. And it'll also be interesting to see how states got involved, because we know that some states also ended up being the grantee and they ended up getting that funding. So waiting to see how states used all of that money, their Head Start federal money, their child care, a block grant, to really think about comprehensive quality services. So I think that there are some examples out there, but I think that we have a ways to go. And I do think that we have to find a balance between the policy, the implementation, the innovation, and the accountability.
Thank you. Any other thoughts on this question? Wonderful. So we've heard a lot about kind of policy with the Big P program, and we also received a couple questions about Little P policy. So kind of what can be done to change policies within specific institutions. And some examples that folks were asking about were institutions that should kind of naturally want to be oriented towards more family-friendly policies, like larger healthcare institutions or other anchor institutions. I think there's a lot to be said here from all the different sectors that you all represent. So let's kick this question off with Sharon.
Sure. Yeah, I think this is a great question. And I mean, in terms of what people can do to change the policies of their own institutions, obviously for workers that are workplaces that are unionized, there is a formal mechanism to try to address this issue. And one helpful resource is Family Values at Work and their Labor Project for Working Families page, which has a database of union contract language for family supportive policies. The other, in other workplaces or just in general, I think individuals can and should educate themselves about what their own employer provides. Review your policies on things like family leave and pregnancy and lactation accommodations. And if you're in a position where you feel comfortable doing so, bring it to the attention of management and encourage them to review them and make sure they're up to date and keeping pace with the needs of the employees. And then, of course, it's always really important to ensure that any policy applies equally to all employees, including those who earn lower wages. And I think another way to think about encouraging your institution to do better is to nurture their competitive instincts and try to learn what your employer's competitors provide in this regard. And if your employer is falling short, point that out and encourage them to change their policies as a way to kind of retain and attract talented employees. In San Francisco, we're part of the Healthy Mothers Workplace Coalition, which is a collaboration of government agencies, including our public health department, employers, and community groups. And we have, for the past several years, held an annual awards program where we actually recognize employers who go above and beyond what the law requires to support working parents. So that's another model that I think could be promising. And we give different levels of awards, bronze, silver, and gold, and we've seen some employers, try to move up a level to get a higher level of an award by improving their policies, and we've provided some toolkits and sample policies for them to kind of assist them in that process. So that's another, model for trying to get your own institution to do better with respect to Little P policy.
Thank you. Other folks want to share any thoughts about institutions at an individual level supporting working families?
Yeah, this is Sherry. I just wanted to echo what Sharon said in terms of the really extreme importance of ensuring that, especially in larger institutions, that family-friendly policies go all the way down and up and down and across, and that everybody that they're the same. If they're good policies, that they're the same good policies for everybody in the business or who works for the employer, because that's something that we see so much, where the higher paid workers have a decent paid family leave policy or decent kinds of supports that just aren't available to other workers in the mailroom or in other parts of the the business. And I think we're really starting to kind of make that an issue and make that an important part of whether an employer is a good or bad employer. And the other thing I want to emphasize is gender equity. It is not a good thing for women to have very, very long and supportive paid family leave or paid maternity leaves, and have none or very, very short leaves for men. Just in terms of gender equity, it's really the public policies all are equal, but there are so few private employers who offer equivalent leave. So that's just another issue that I just think is very important.
And Kimarie, I think I heard your voice on the line.
Yep, you did. So I also wanted to mention a program called the Business Case for Breastfeeding, which was done by Health and Human Services, Office of Women's Health, which is a phenomenal program that traveled all over the country and looked at workplaces, like the strawberry fields in California and the carpet industry in Georgia, and different the poultry the companies in different places, and how they accommodate their workers, and specifically how they accommodate women at work in breastfeeding. And they've put together elevator talks and posters and brochures for the employer and brochures for the employees and information for human resources on why your return on investment would be tremendous if you allow these things to work. So it's a free resource. It's phenomenal. It's called the Business Case for Breastfeeding.
Wonderful. Thank you. And Yvette, any last thoughts on connecting childcare and family-friendly policies at the institutional level?
Yeah, I mean, I think it's sort of an interesting question, because I do think that within institutions we still struggle because we want to be seen as a business, right, quote unquote. And I think that because of the type of work that we do, folks often find themselves in a really tough spot. But I will say that in places where we've seen really good policies around supporting families, and particularly new moms and dads, it's really been because those employees have really pushed leadership to think about that and to make those changes. And I would just agree with all of my colleagues that if you want to keep good people, you have to be able to support them as their needs change and as their families change.
Well, thank you, everybody. I think that we have just about hit time, and I want to pull together a couple of threads that I'm hearing from this really great conversation. And I think one is that really everyone in every sector has a role to play in supporting working families. We heard about how people at the individual level can support working families, how institutions, program staff, healthcare, and other sectors and policymakers can all come together in different ways to make sure that working families get what they need and access the resources that they need to be successful. We also heard about the nexus between policy and program, both little p and big P policy, and similarly some of the opportunities for cross-sector collaboration that exist there. And last, I just want to uplift this idea that policy, program, and practices are only the start of the journey to supporting working families. We heard some really great insights around some of the new challenges that arise when we get to steps of enforcement, implementation, accountability, and how it's really important to make sure that we continue following those threads to make sure that we're pursuing a lot of these health equity goals that were so well articulated around making sure that all families get what they need. So with that said, I'm going to offer my sincere and wholehearted thanks to our panelists for joining us and sharing their expertise and their insights, and tell you all a little bit about what you can expect for Episode 3. Episode 3 in our series is called Building Healthy, Equitable Communities Through a Just Food System, and it's going to launch very shortly on June 4th. It's going to check out the intersection between food and procurement strategies as a driver of health equity. And then on the screen you can see the schedule that we have for Episode 3. I also want to highlight some of the resources we have for healthy change making. We have a suite of tools on paid family leave as a driver of health equity, and we also heard a lot of our panelists articulate some really great resources that I encourage you all to check out. Our resources are available on our website, changelabsolutions.org, and we hope that if you don't see what you're looking for on our website, you'll reach out to us, and perhaps there may be an opportunity for us to provide technical assistance. So last, we would really encourage you all to keep the conversation going. On this slide, you'll see all of our presenters' email addresses. Everyone has really graciously agreed to keep the conversation going with folks, and you can reach out to them if what you've heard today has sparked anything that you want to continue talking about with us. And I would also say that if you didn't hear your question during this episode, it may be that future episodes will answer them. And please stick around. As soon as this webinar ends, you'll be directed to a very brief survey that will be incredibly helpful for us as we continue to shape this conversation. Again, with that, my thanks to all of you for your participation, engagement, and questions, and my thanks to our panelists for so generously sharing their time and expertise. Thanks all so much, everybody.